If you come across ads for Primo TRT gummies, you've probably seen some bold claims. Things like boosting your testosterone, feeling young again, getting your energy back, and improving your strength or even libido. It sounds pretty appealing, especially if you're someone who's starting to feel the effects of aging. The product is positioned as a natural supplement designed for men whose testosterone levels might be dipping as they get older. The idea is that with just a daily gummy, you can start to feel a difference. But let's pause for a second and talk through what's actually going on here. First off, just a heads up, this isn't a promotion or review. This is just about looking at the information that's out there and raising a few questions people might want to ask before trying something new. It's always best to do your own research and talk to a healthcare provider if you're thinking about trying any supplement. So, one thing that stands out is the way the product uses the phrase FDA approved in some of its marketing. At first glance, it might give the impression that the product has been officially reviewed and approved by the Food and Drug Administration. But if you look closely, especially at the fine print, it says the FDA hasn't evaluated the statements made about the product. That's actually normal for dietary supplements, since the FDA doesn't approve them in the same way it does for prescription medications or medical devices. Still, it's something worth being aware of, especially if the labeling seems a little too confident. Another common theme in the marketing is the focus on natural ingredients and the suggestion that there are little to no side effects. And yes, the ingredients they mention, things like Tribulus terrestris, fenugreek, D-aspartic acid, and zinc, are found in a lot of over-the-counter testosterone support products. But just because something's natural doesn't always mean it's completely risk-free. These kinds of herbs can still interact with medications or cause reactions in some people. So, saying side effects are rare without more detail can feel a bit vague. It would be more helpful if there were clearer info on who should or shouldn't be using it. Also, while the formula might sound impressive, these ingredients are actually pretty common in the supplement world. There's not a lot of strong clinical evidence showing that they lead to big changes in testosterone levels for healthy men. That doesn't mean they don't do anything at all, but it does mean the dramatic claims might be a bit of an exaggeration. One other thing that's a little confusing is the name Primo TRT. The term TRT usually refers to testosterone replacement therapy, which is a medical treatment prescribed by doctors. It typically involves things like hormone injections or gels and is used under medical supervision. But in this case, Primo TRT isn't an actual TRT product. It's just a supplement and doesn't contain testosterone. So, the use of that term might give the impression it's something more medically involved than it actually is. All in all, while the product might look appealing at first glance, there are a few things that are worth thinking about. The way it uses the FDA name, the big promises around benefits, the very common ingredients, and the use of medical-sounding terms. If you're experiencing symptoms of low testosterone, the best approach is still to talk to a healthcare professional who can guide you on what's safe and effective. Taking care of your health is important, and knowing what's behind the marketing can help you make more informed choices.